Imagine a puzzle where the pieces don't fit together quite right. That's what's happening inside the bodies of people with MARFAN syndrome. Now, you might be wondering, what is MARFAN syndrome? It's a disorder that affects the body's connective tissues. Those are like the glue that holds our bodies together. They help support the skin, muscles, organs, and blood vessels. But in MARFAN syndrome, this glue isn't as strong as it should be. As a result, many different parts of the body can be affected, from the heart to the eyes to the skeleton. It's like having a puzzle where not only the pieces don't fit, but they're also a bit fragile. It might seem like a scary thought, but understanding is the first step to tackling this puzzling syndrome. MARFAN syndrome can sometimes be like a chameleon, changing and hiding in plain sight. It's a disorder that, in its subtlety, can sometimes be tricky to spot. But with a keen eye and knowledge of the signs, it becomes much easier to identify. So, what are we looking for? The signs and symptoms of MARFAN syndrome can be as diverse as the people it affects. No two cases are exactly alike, making this a bit of a detective's job. Some individuals with MARFAN syndrome might be notably tall and slender. They may have long arms, legs, and fingers that are disproportionate to the rest of their body. Their joints might be unusually flexible, bending and moving beyond the average range. However, it's crucial to remember that some people might not show any outward signs at all. This doesn't mean they're not affected. It simply means the signs are internal or less obvious. The clues are there. We just need to know where to look. Now let's dive into some numbers. Don't worry, we promise it won't be boring. MARFAN syndrome is fascinating, and its impact is vast, touching the lives of many across the globe. In the grand scheme of things, this disorder affects approximately 1 in every 5,000 individuals. That's the equivalent of a small town's population. But what about the gender distribution, you might wonder? Interestingly, MARFAN syndrome doesn't play favorites. It occurs equally among males and females, showing that it doesn't discriminate based on gender. That's right, it's an equal opportunity condition, affecting both men and women alike. These numbers may seem small in the global population's context, but remember, each statistic represents a unique individual, a distinctive story. It's a reminder of the human aspect behind the numbers, the people living and thriving despite their diagnosis. Remember, numbers are just numbers. Behind each one is a person, a story. Living with MARFAN syndrome may not be easy, but it's certainly not a death sentence. With the right treatment and management, individuals diagnosed with this condition can expect to lead fulfilling lives. In the past, MARFAN syndrome often resulted in a shortened lifespan due to complications in the heart and blood vessels. However, thanks to modern medicine's leaps and bounds, the survival rate has improved significantly. Today, healthcare professionals can provide treatments and interventions tailored to an individual's specific needs. These may include medication, lifestyle adjustments, and sometimes surgery, all aimed at preventing or managing complications. Regular checkups and monitoring are essential, ensuring that any changes are caught early and managed effectively. This proactive approach to treatment has dramatically increased the quality of life for those with MARFAN syndrome. So, while MARFAN syndrome may be a puzzle, it's one that science is getting better at solving every day. With continued research and advancements, there's a bright future ahead for those living with this condition.